And we're back with On the Record with Tiffany and my special guest, Dr. Anil T. Mangla. Dr. Mangla is working on contact tracing for the U.S. government. Dr. Mangla, will you tell my audience a little bit about what you're doing?
Yes, good afternoon, Tiffany. My name is Dr. Mangla. I have worked with COVID for the past 7 months, actually from the beginning of the pandemic. At the moment, I did many consultation commissions in Texas. I also served as the chief epidemiologist for Comal County. And for the past 4 months, I'm the team lead here for the epidemiology outbreak investigation team. What our team does is we identify any cases, and the investigation team does a thorough investigation on that particular positive case. And then we identify normally the contacts, and that's very important because as soon as we identify contacts, we try to quarantine them for the 14 days so they do not spread the disease to anybody else. Why contact tracing is important is because these are individuals that get exposed. They don't know if they're positive yet, but we have seen a significant amount of individuals that were close contacts that actually converted to a positive case. And so this enabled us to stop the spread of the disease by quarantining those individuals. And normally what we see, and this is a national number, from every one positive case, there's at least a minimum of 5 to 6 contacts. So you can imagine in some circumstances, example, schools or daycare centers, you're going to get a class that is close contact, meaning 20 people. So, when you look at those numbers, you now can understand why our numbers are increasing so significantly.
So going back to school, how have you seen a change in numbers with the contact tracing in regards to schools and children?
Well, this varies from state to state, and I think there's a lot of moving parts. Many moving parts are going to actually identify, what has the school implemented? Is the school safe? Mm-hmm. Do they have cohorting? Do they make sure that they don't have floating teachers? Is there a compliance in masks, social distancing, hygiene? So there's many components that actually dictate how safe a school is. If these things are not in place, you're automatically going to see a significant increase in cases. But you need to mitigate those cases in ensuring that they listen to public health officials and follow the recommendations we are providing to all these entities.
When you all are talking to when the scientists say that we need a national response, can you explain to our audience, the kidney disease audience, what do you mean by what is a national response going to do for us?
National response is very important. So let me put it in a different way. As the chair of the Texas Kidney Foundation, I feel that this national response is something that was supposed to happen months ago. This is a response that is actually providing standardized measures, no matter what state it is, no matter what organization it is. And so
that's right.
As we start mitigating these cases in one state and not the other, but without this synchronized message to every governor, every state, there's a need for that, especially now, because then it's a standard message no matter what state you live in. You're going to have to maybe quarantine. You maybe, going to have your masks on all the time, decrease or limit activities, and avoid any large crowds. And so if one state does that, if another state does not do that, it doesn't help. It needs to be a complete response nationally or nationwide in order for any of these recommendations to actually work.
So what would a complete response look like in your opinion?
there could be a variety of things of a national response. It could be mandates. So, we have already shown wearing masks significantly decreases the spread. As a CDC, initially our thought was, and if you remember many of the sessions we did earlier this year on COVID, we said wearing a mask is actually helping the others from contacting the virus, less ourselves. So if everybody wears a mask, it's going to help the entire population or the entire group. Today, there was more information from CDC that it's both ways. Actually, wearing masks is even helping you yourself. And that's a message I hear all the time because of two important things. When you're wearing this surgical mask, there's two components to a mask which many don't know. And so I'll share the knowledge with you guys. When you're wearing these surgical masks, the inside of the mask is an absorbent layer. So if you cough or sneeze, that's been absorbed. It's not going out. But the outside part of the mask is a waterproof layer, right? So if someone's coughing, it's waterproof. It's not getting into your mask. So the purpose is not just you're not spreading it, but others are not spreading it to you because that mask serves a dual purpose. So that's kind of one of the areas of really focusing on a national, I'm sorry.
It's okay.
When we're looking at a national kind of response is mandatory masks or, making sure everybody's social distance, identifying the hotspots where the spread is occurring. So, everybody has been very casual in the past month of, okay, I'm going to go to a restaurant and I'm going to go here and I'm going to go there. And as you see, the spread is increasing because people are taking it much easier than they should have. And we all understand, we have this COVID stress with us, but we need to bear in mind that, we need to do this for ourselves, but also protecting others because we are now losing almost 2,000 lives per day.
As a transplant recipient, how are you viewing this? Because our population is one of the most at-risk populations in the country, and that's a topic that we haven't heard a lot about. Can you
Yes.
talk to it? Can you speak to that?
It's a very emotional topic for me, so mind my words or mind my my voice because it gets emotional. Chronic kidney disease patients are at a very, very high risk for multiple reasons. But I'm going to share with you some of the data we already know that a chronic kidney disease patient is 4 times likely to land up in hospital.
Mm-hmm.
Without doubt, just from the top of it all. And so that's one. Number 2 is we more prone, we are more susceptible to the disease because of our condition. And so we need to be even extra cautious, not just staying home or not just not going anywhere, but making sure that people are not visiting us that often, bringing it to us. And so there's so much guidance that we need to follow to ensure that we do not, at any circumstances, get infected. Now, I talk about this because I serve as a first responder official. And as a first responder official, I got to be even extra careful. But I'm going to tell you what. And I'm going to tell you that Dr. Fauci and all these other experts, public health experts, have said this numerous times. They keep saying it. Keep your distance. Keep your mask. Hygiene. Avoid crowds. And if you can do that, you're going to mitigate this disease. I say it because as a frontline responder, I have followed those guidance to the T. I avoid individuals as much as I can. I try to work from home as much as I can. I always have a mask anywhere I go. Even if it's just going out for a walk, I have a mask. I make sure I'm socially distanced, and I frequently wash my hands. Touch wood, in the past 8 months, I have not got infected. But I'm proud to say if the recommendations is help me, an individual that is so high risk, then it can help anybody else.
And I want you all to come back and continue to listen to what Dr. Mangla has to say. In our next segment, we're going to talk about what Dr. Mangla, Texas Kidney Foundation, and the team that he is leading as in his professional time and in his personal time. Let's talk about a little bit about what Dr. Mangla is doing to help our kidney community, because this is your true kidney crusader here, who's spent his life and his time dedicated to helping you. So let's listen to what an expert and a person who's dealing with chronic kidney disease has to say. There's lots to learn. So come back and let's continue to listen to On the Record with Tiffany with my special guest, Dr. Anil T. Mangla.